Should I have children if Huntington's disease is in my family? Imagine facing a choice that could affect your future family for generations. When Huntington's disease is part of your family history, deciding whether to have children can be complex. Huntington's disease is a hereditary brain disorder caused by a mutation in the HTT gene. This mutation involves an expanded sequence of CAGS repeats. If a parent has the mutation, each child has a 50% chance of inheriting it. The more repeats, the earlier the symptoms tend to start, sometimes even in childhood. Since there is no cure for Huntington's disease, the decision to have children involves weighing the risks carefully. Adults at risk can choose to undergo predictive genetic testing. This blood test can tell if they carry the mutation. Testing is usually offered to those over 18 after counseling. If someone tests positive, they then face options to prevent passing the disease. One option is preimplantation genetic diagnosis, which is used with in vitro fertilization. Embryos are tested for the mutation before being implanted, so only those without the mutation are selected. Prenatal testing during pregnancy, like chorionic villus sampling or amniocentesis, can also identify if the fetus carries the mutation. These tests help parents make informed choices early in pregnancy. Another option is using donor sperm or eggs from someone without the mutation. This completely removes the risk of passing Huntington's disease to children. Adoption is also a possibility for those who want children but prefer to avoid genetic risks altogether. Deciding on these options can be emotionally challenging. It involves balancing personal desires with the potential impact on future children. Talking with a genetic counselor can help clarify your options and support your decision-making process. It is also important to consider the phenomenon called anticipation. This means the number of CAGS repeats can increase in each generation, sometimes leading to earlier onset and more severe symptoms. This adds an extra layer of unpredictability to family planning. Families affected by Huntington's disease can access support groups, counseling, and medical care to help manage the emotional and practical aspects of this decision. In the end, whether to have children when Huntington's disease is in your family is a deeply personal choice. It depends on your values, your understanding of the risks, and the options available to you. Consulting with healthcare professionals who specialize in genetics and hereditary disorders is essential. They can provide the facts and guidance needed to make a decision that feels right for you.